Hello students, today we'll talk about how to assess the heart size on a frontal chest radiograph. For this measurement, we have cardiothoracic ratio. We'll see what do we understand by this term, how to calculate this cardiothoracic ratio. First of all, what we'll do, we'll draw a line joining the spinous processes of vertebral bodies, lower thoracic vertebral bodies. Then we'll see the maximum diameter. This is the maximum diameter on left side and this is the maximum diameter on right side. As you all can see, this is the cardiac cell out here. This is the cardiac cell out here. And now we have to calculate the thoracic cage. This is the widest diameter of thoracic cage here. So I'll do the markings. I'll mark this A, this B, and this is C. This whole line is C. Now, what would be the cardiothoracic ratio? In numerator, we will have cardiac. In denominator, we have sizes of cardia and thoracic. This would be the cardiothoracic ratio. What would be the cardiac size here? The cardiac size would be A, the right-sided heart size, plus B, the left-sided heart size, upon C, the whole transverse diameter of the thoracic cage. This will give rise to the cardiothoracic ratio, and it should be always less than 50% on a PA radiograph. Mind you, I am talking about the PA radiograph. If this is not the case, this would be the normal size, but on a PA radiograph, if we'll get this data, if we'll get AP radiograph, then this cutoff would be approximately up to 60%. More than 60% CTR would be considered abnormal on AP radiograph, whereas more than 50% on a PA radiograph would be considered abnormal, preferably except in neonates. What do we imply from that? That up till 50% CTR on PA is normal. More than 55% is abnormal. But exception is neonates. They normally can have more than 55% of CTRs, and sometimes in some cases up to 60% also. So CTR of less than, cardiothoracic ratio of less than 50% is considered normal on PA radiograph, whereas CTR, the same CTR of less than 60% would be considered normal on AP radiograph. And what is the reason for that? The reason for that is apparent cardiomegaly, seen on AP radiograph, which was due to the lesser source to image distance and the anterior to posterior technique. Thank you for watching.